A very good morning to you all. I am Dr. Bhatia, member of team DBMCI, and today I am sitting here in the studio with the radiology legend, Dr. Rajat Jain. Thank you, sir, for being here.
Thank you, doctor.
And DBMCI team has got an N number of queries. How to approach the new set of rules judged by the NBE. The NBE has got some very scintillating news for all the PG aspirants for this year. The NBE has judged that the session will be conducted on one day with negative marking, and we have got a lot of questions from the students such as how to approach this exam, how to get a revision strategy, and what mindset a PG aspirant should have to actually combat this exam. Dr. Sahab today is going to have a discussion with me on all those points. Sir, first of all, what impact will a student get when he hears that now the exam is a one-day session?
Thank you, Dr. Nachiket. A very good morning to all of you. As far as the single day exam, it's a very good news for the students. The basic reason behind that is that previously there were a lot of speculations that there will be a psychometric analysis, there will be scaling, some question is easy, some question is difficult. There were a lot of gaps. You were not aware if you have got 200 correct whether your marks will be 200 or not. There were a lot of ambiguity in answering, but now everything that will matter is your true score. That means if you are marking 200 correct, it is 200. If you are marking 250 correct, it is 250. Obviously, we will take care of the negative marking that we will be talking subsequently. But the most important point is now your score will belong to you. So I think it's a very good news. I welcome this decision of the NBE that it will be a single day, single session exam, and it's a very good, very positive news for the students. Some students are panicking in this particular way that probably they were doing the paper later and they will be able to understand the pattern. So see, the pattern is right in front of you. The national board is conducting the exam for last so many years. We know as a part of DBMCI we have prepared the students in a way so that they are able to handle whatever is the pattern. So they need not to worry about that particular thing. Pattern is in front of you. We can tell you the pattern right now, that what will be the pattern. So you need not to worry about that. It's a very good news that it's a single day exam for all PG aspirants.
And I don't think that NBE in a body itself would be actually focusing on the long cases or the long questions. They will be more focusing, just like previous years they did, on the one-liners and the same kind of questions they did previously, right?
Well, Dr. Nachiket, if you see the pattern, see, like when we gave our exam, there was no national board at that time. So all the exams, including the All India, was conducted by the AIMS. AIMS was obviously conducted by the AIMS. In that scenario, the pattern was more of lengthy questions, like almost like a half-page question. Then there came the DNB exam. Previously, there was no exam in the DNB. Then came the DNB exam. All India was being conducted by the AIMS. AIMS being conducted by the AIMS and the National Board. National Board, if you see the faculty set, National Board has different set of faculty, whereas AIMS has got different set of faculty. AIMS paper is prepared by the AIMS faculty, whereas National Board paper is prepared by a pool of the faculty which include the professors of the medical colleges and even some of the private practitioners. I don't think that there will be too much change in the pattern. First. Second important aspect is that has happened is that previously the National Board was conducting so many papers, like they have to conduct morning evening session for 7 days. So they're almost making 10 to 14 papers.
So that's the major point.
Yeah, they're making 10 to 14 papers. So their question bank for the one exam, that means one single exam like NEET 2016 was more than 5,000 questions. Now they have to make only one paper. Okay, so in that one paper they have to make 300 questions. So they can slightly make a conceptual paper. That is definitely, I agree on this particular part. But having said that, getting more lengthy questions of half liner, one liner, not one. Second important point that I want to highlight on here is that if you see, do you think it is a question that makes difference? Not at all. In an MCQ paper, it is the complexity of the choices that makes all the difference. I can ask one question in so many different ways by giving you some different confusing choices where the student is not able to answer. Do you think AIMS paper is really difficult? I disagree on that. In conceptual question, they will give you so many information that it is much easy to solve, but it is the complexity or the closeness of the choices that makes the answer difficult, okay, rather than just knowing about this. So you need not to worry about that. If your concepts are strong, we have given you enough fact-based information. Now the problem that were happening in the NEET paper, they were asking some nonsense questions. Louis Pasteur died in which year? What is the speed of the mosquito? They were helpless because they have to conduct so many questions, they have to give so many questions. These questions were coming up. So I don't think these questions will be there, but still you might be having 2 or 4 fact based questions, but as we have already told in our classes also, these questions never change your rank. So friends, you need not to worry about these 2-4 questions. You should focus on your revision at this point of time. The next few months will be very, very crucial for you. Stay focused. We have given you enough information in all our classes, irrespective of the paper. I can tell you that whatever paper will be asked, it will be majority from our notes.
Now that's the last point every DB mind hearing this video should actually focus on. All the information that you need, that you require, and that will make you a winner is there in your notebook. So read the DBMCI notes thoroughly before going to the NEET exam. Now coming to the next question, the importance of negative marking. Dr. Saab, you can't believe me that I've got 1,000 queries right now stating the fact that how can my test result be affected by the negative marking?
Well, so probably I will say that this is one of the most important question for which I am here, because even I have got lot of mails, lot of messages from the students on how to deal with this negative marking. Friends, we have been through this particular phase, and during our time all the exams were having negative marking. The negative marking was not there in the last few years. If you see, negative marking is 25%. First of all, there are 2 things that you need to understand. The negative marking simply preventing you in taking a blind guess. That's all. First. Second important aspect, it is just 25%. If you are marking right, you are getting 4. If you are not marking, you are getting 0, and if you are marking a wrong answer, you are getting -1. It's a clear science. There is a probability. We have been toppers, all of our friends have been toppers, lot of our students were topper. I am telling you the simple feedback of lot of students in the last few years. You should not leave too many questions, full stop. Just because an exam has got 1/4 negative marking should not prevent you in marking too many questions. One, having said that, that does not mean that you should take all the blind guesses. No, I am not saying you that. Calculative guesses, intelligent guesses, there are a lot of things. See, the beauty of an MCQ is answer lies in front of you, friends. You need a vision to see that particular answer, and this is what has been taught to you in the classes, how to see that answer in amongst the 4 choices. You cannot have an easy exam than that answer is lying in front of you. As far as there is 1/4 negative marking, please don't leave too many questions. When we attempted the paper, there was 1/4 negative marking. Just to give you my example, I attempted all questions in my paper. All questions means all questions. All questions. Okay. So negative marking should not be a deterrent factor. I'm sure that you are having some query on this particular part.
My query right here is that, okay, I believe you that we should not leave any questions. The point comes in how many questions we should attempt.
Okay, so let's take few examples. I will take some examples from the previous years and from the toppers. I was taking a class in Bangalore, and there is a student. After the class she messaged me, and that question was, hockey stick appearance on echocardiography is seen in. Now this is one question which has never been asked in a PG entrance exam. The answer was mitral stenosis. I messaged her that this is the mitral stenosis. She replied back, sir, I marked mitral stenosis, but then I changed the answer and I did aortic regurgitation. I said, it happens. She said, no sir, my luck is bad. If I'll take a guess, my answer is always wrong, and I have decided that I will not take too many guesses after that. What will you say? Have you come across students who say this?
Of course,
that our luck is bad. So friends, there is a very, very simple theory on this. Whenever you are confused between the choices and you take a guess, you come back, you check your answers. If your answer is wrong, you think that you have taken a guess. But if your answer is right, you never think that you have taken a guess. You only think that there is small confusion, and that is why, otherwise you knew the answer. But if your answer is wrong, then you think, oh, I have taken a guess, and that is why my answer is wrong. Okay, and that is why this element of bias comes, and you think that if you have taken a guess, your answer is wrong. Friends, it's a simple science, it's a simple probability. If you will take intelligent guesses or just random guesses, if you are taking guesses on 20 questions, 5 will be right, 16 will be wrong. But problem is, as a student, we think if I am taking guesses on 20, all 20 should be right, and I am ready to leave all of them. Please don't do that. If you are leaving more than 10 questions in your paper, it simply means you are gifting your rank to somebody else. That is one line answer. If you are leaving more than 10 questions, it simply means you are gifting your rank to somebody else. And why I have given you this margin of 10 questions, friends? It is a very simple. I have personally experienced this, that sometimes there are questions on which your pen does not work at all. I mean, you are not able to simply mark the answer, or you have no idea from where the question has been asked. Leave them. But that should not be more than 10. I will give you a small example on this again. Let's say you have no idea about 70 questions. No idea about 70 questions. That means you know only 230 questions. First of all, tell me, do you think all 230 are right?
Of course not.
Of course, that means you are taking guess in those 230 also, na?
Of course.
So please, dear, understand, when you are taking guesses in 20, why you are leaving 70? Please take guess on those 70 also. Either mark only those answers on which you are absolutely sure, or if you are taking 10 guesses, please take all. In my last so many years, I've been into this field for more than a decade now, I have come across only one student. He was my batchmate from PGI Chandigarh when we started working together. He wrote May Aims. We came back and I asked him, how many questions have you attempted? He said 129. I said, are you mad? 129? What do you think? How many will be right? He said 129. And do you know? He got 128 correct. He is the only person I have come across in my life who has marked only that answer on which he is absolutely sure. So friends, either be that sure. But if you are not that much sure, then please don't leave it for somebody else. Yes, if you think that your pen, you are not able, don't stress yourself, don't push yourself unnecessarily. Please find out intelligent guesses. Most of the time, I am telling you, if you have read our notes well, if you have given all our tests, if you have asked your queries, if you have done the previous year questions paper well, you will be easily able to rule out 2 options. And if you can rule out 2 options, it is a simple stupidity to leave that question.
The main reason to actually make this video was to get Dr. Saab's idea in your minds. Dr. Saab, I saw so many people on YouTube, on Facebook, putting up ideas that only you should attempt 250 questions, only you should attempt 260 questions. So that's why when I had a talk with you, I found out that people should know that their luck matters for them the most. Do not leave everything to luck, but do not take away your luck from yourself.
Dr. Nachiket, I'll give you a very simple example.
Sure.
Most of the students believe on this particular part that their luck doesn't favor them.
Exactly.
Dear students, I want to say only one thing. See, whatever you do, your luck has to favor you. Because if your luck is not favoring you, irrespective of the hard work that you are doing, you will not be able to crack this exam. Because you cannot do everything. Whatever you will leave, that will be asked in the exam.
Exactly.
And trust me, all of us have got very, very good luck. We are here. We have completed our MBBS. We all have that magic word DR in front of our name.
DR dot.
So that means we are lucky. That means we are lucky. So that luck is favoring us. We are sitting here. We are lucky that we are sitting here. So don't think that your luck is not favoring you. We are amongst the most privileged people. So we are lucky, and that is why we are privileged. So dear friends, the luck is favoring you. But let luck play a chance.
That gap between 250 to 290, now that is the part where we give the chance to luck factor and if we score, let's just say that 25% of total answers we score right, we are above else, right? So that's what we are looking for.
There is a very simple thing. Do you think what is the difference between the rank number of marks difference between, let's say, rank 1000 and rank 3000? What do you think? How many marks difference should be there?
5 to 10.
Yeah. Please understand on this particular point. It's hardly. But again, I am not telling you do an akkad bakkad bam babu and mark the answer. Take intelligent guesses. See, every question. Maybe we can do this particular thing, though we have conducted this in our classes also, but we can do this particular thing where we will tell the student how to select the answer from the choices. See, the beauty is answer is in front of you, the answer is staring at you. Develop that vision that you should be able to stare back on that particular answer. When the examiner, think from the level of the examiner that once he has made that particular question, what is going on in his mind, and I can assure you that everything is in your notes. The only thing that is required is the proper revision of your things that you have done.
So before we move on to the next question, so to all the DBMCI family members, that sheet of paper will decide your future. So do not leave any attempt and do not leave any stone unturned. Give those 40 questions your best, and I'm sure that your name will be amongst the toppers. And to the next question, Dr. Saab, what should be the revision strategy?
Dr. Nachiket, 90% of the mail that I get from the student is in the month of September, or maybe you can say early October. Why? Because most of the students have completed their course by now and they are starting revision. One of commonest problem that I have seen is that students are depressed at this point of time. Why? Do you know what they do? I remember when I started my revision, I opened my book and I realized, oh my God, I don't know whether even I have read it or not. Leave it whether I know it or not. After reading it, I am not able to recall whether even I have read it or not. But because it was underlined, it gave me confidence that I have read it. But what is the point? I cannot do it. Now friends, I am telling you, by the grace of God, I got very, very decent ranks in my paper, and I am telling you my own story. That means in the month of September, when I opened my book for the revision, I was not able to recall majority of the things. That is the role of these 3 months. Now there are 2 options to you. One is get depressed and think now you cannot do anything, or stay focused, think why you don't know it. Revision. Do revision. Revision means revisit. What do you mean by revisit? Revisit simply means whatever that you have not, whatever you have read, please revisit that. Majority of the students have a simple understanding. If I talk about myself, I was a very, very average student. You need at least 3 readings to remember something for a long term. At least 3 readings. Some students can do it in 2 readings, some students can do it in 4 readings, but majority of the students need at least 3 readings. So that means whatever that you have done in the last 6 months, you have to consolidate in a way that you will be covering everything in the next whatever time that is available for you. Okay, divide that time into 2:1 ratio or 3:1 ratio. That means first revision should take the first time and the next revision should take. If you have read something thrice, trust me, you will be able to recall it in the exam. So just write all the grand test, just write our revision test series. They have been accustomed, they have been specially prepared for you on this particular part. Make sure you are identifying your forgettables. There is a very, very important point. See, everybody is trying to find out the ranks. So all India ranks are definitely important. There is no doubt about it. But I like your idea. What you said was a very, very good idea, that as a part of these tests, what we are giving is, we are giving to the students that you did this question wrong. Why? Because that is the basic purpose of the paper, where you can identify that you did wrong question on HIV. Now you can identify, that means HIV, so that means you need to revise this particular topic, because I have a simple rule. If I have read something, I will mark it right. If I have not read something, leave it. Every student has a limit. Please identify your limit. From today onwards, everybody of you has to do a pledge with yourself in the morning, and that pledge is, if you have read something, you will be able to mark, you will mark the right answer of that particular question in the exam. Full stop. There is no excuse on that.
In fact, and what Dr. Saab was talking about was that I found out that students are getting crazy about their all India ranking. They are more concerned that they stood first among 30,000 people rather than focus on what subject or what subtopic they did wrong. Let's just assume that out of the 300 questions you did 250 right. The 2 questions you did wrong, which in spite of that you were ranked 1 among 30,000 students, were of diabetes. And in the NEET exam, 3 questions with a competition of 1.5 lakh students, 3 questions come from diabetes. Of course, you have not, the diabetes is not a good topic of yours and you will do those questions wrong. Now, where is that rank 1 now?
Yeah, that's the same point that we were addressing. See, it is good to get a rank 1 in among the 30,000 students because it will give you your standing, where do you stand. But this is a very important point what you are highlighting, that see, that's not the end of the world. The important point is, see, you are competing with the 50,000 student, I do agree, but there is lot more students who are still left. Aim is that if a question has been framed and you don't know the answer of that, you should know why I don't know the answer of that particular question. And if somebody is telling you that, student, this is where you are committing a mistake, please identify what I told you, identify your forgettable and do a work on that. That is the basic concept of doing these papers. When I was doing these papers, I was not bothered about how many corrects I have done. I was more bothered how many wrongs I did and how many were the silly mistakes, where I went wrong, which were the topic that I should know and I don't know, and I will work on those topics which will give me an edge over others.
So that is why on 12th of October, DBMCI Grand CLT, the computer live test, Pan India will be done. You will have a competition of 15,000 to 20,000 students, but the most important part will be that the artificial intelligence test analysis will be used, which will provide you a hands-on summary that these topics or subtopics were done wrong by you. Now that is the purpose of our being, that to provide you how you can improve on every step. You will get a very good rank, I'm sure of that, but we want you to improve at every moment. The DBMCI Grand CLT will be just the one step, the revision test series, which we divided among subjects so that the similar subjects can be revised by you and then you can test yourself to know where you stand. This test series is accustomed with negative marking with an all India ranking again. And for all the DBMCI family members, we are going to conduct another Grand CLT, but we are waiting for the right time because there is no mention of the date as of the NEET yet. The moment the NEET date launches, DBMCI will conduct another test so that we can make sure that DBMCI family is prepared for the worst. We are going to make sure that DBMCI family has a habit of giving NEET regularly. That is why, that is me, DBMCI team members, Dr. Jain and Dr. Bhatia signing off. Thank you so much for listening.